Well, good morning, everyone. Thank you for attending our second survivorship webinar series. This is co-sponsored by the Cancer Research Advocacy Group at the University of Illinois, the Cancer Center at Illinois. It's part of the University of Illinois, as well as Illinois CancerCare. We're really excited today to bring you a session on mental health and dealing with or coping with your mental health as you face a cancer diagnosis, the treatment that follows, and then into survivorship. And we're really fortunate today. We're joined by Seth Errion, who's from Illinois CancerCare, and he's a counselor who specializes in people going through an oncology or a cancer diagnosis. So we're really fortunate to have him. And then we have several cancer research advocacy group members as well. The format today is first Seth is going to give a presentation on sort of tricks and tips for coping with the diagnosis. And then after that, we're going to have a roundtable discussion with cancer research advocacy group members, talking about how some of their coping strategies, things that have worked, and then a whole bunch of other things that we've got on the agenda. Everyone right now should be muted and your video is off. If you have questions during Seth's talk, please use the question and answer function of Zoom, and I will be able to narrate those questions to Seth. And then during the roundtable discussion, again, you can also use the Q&A, or potentially you can raise your hand and then we can get you to unmute yourself. So I guess the one other housekeeping note is we are recording this, and we'll be posting this onto our website so you can have access to it for the future, as well as people who couldn't make it today can access it at will. And then Seth has really kindly agreed to post his PowerPoint slides as well to our website. So those will be posted probably in the next couple of weeks if you're looking for it. All right, without further ado, I'd like to introduce Seth Errion. Sorry, I got your name messed up.
Oh, no worries.
From Illinois CancerCare, who's got a presentation ready for us. Thank you again.
Thank you. Let me share my screen here. Alrighty. So like you mentioned, I'll be going over, again, mental health and cancer, and tips and tricks, tools to navigate those unknowns. So what we'll be reviewing today, just a quick thing about me, and then we'll be going over common emotions, common experiences, tips and strategies for coping, next steps, and then we'll have time for some questions if anyone has any. So a quick thing about me, I'm the oncology clinical counselor at Illinois CancerCare, so I provide the mental health services for all 14 of our clinics across central Illinois. And I often get asked, why oncology counseling? Why did I want to go into this, and why is it important to me? So I always tell the story of my maternal grandmother was diagnosed in 2012 with lymphoma. Sadly, she succumbed to the disease after a relatively short period of time, exactly 2 weeks after her 74th birthday. And that's why I wear this lymphoma pin in her honor. During this time, I consistently saw her ask for a mental health professional, and she was provided members of the clergy, but never a mental health provider per se. And I saw she wrestled with the mental health and mental and emotional struggles that most individuals with a cancer diagnosis face. And when I found this internship at Illinois CancerCare at the end of my counseling program in 2019, I knew it was my calling. What I like to tell people is that much of the knowledge I have about oncology, mental health, is not from a textbook or formal classroom courses, but from the stories of people like my grandmother, the survivors I work with every day, and all of you here today. So first thing is common emotions. So I get asked this a lot too, what emotions are normal? during my cancer journey. And maybe you can think of some right now as you're sitting there, what emotions you may have faced. And I love this question because it's sort of a trick question, because the answer is all of them. All of them are normal. There's no such thing as a abnormal emotion when it comes to your cancer journey. So again, all emotions are normal and important. From my perspective as a counselor, my theoretical orientation is they tell us something about our experience, right? It's what we do with our emotions that matter. I believe that emotions are not inherently positive or negative, even though we tend to ascribe that to them. They just are. So we've got our core emotions of happiness, sadness, anger, fear, disgust, and surprise. Happiness tells us, I want more of that experience because it makes us feel good, or sadness tells us that someone or something that is meaningful or important to me is no longer there, or is in danger of no longer being there. And it can also connect us to one another. Grief is a good example of that. Sadness and grief connects us to one another. Anger, my boundaries or sense of safety has been violated. It's again an attempt to protect the self. Fear, someone or something is potentially dangerous to me. Again, another way to try to protect ourselves. Disgust, this is unpleasant or offensive, might even be dangerous to me. Surprise, that's our reaction to our body's natural startle response, that fight, flight, freeze, or faint. So the sort of humorous way that I always tell people that I'm working with about this is, I can be angry, right? And I can either talk it out with the person I'm angry at. We can figure out what was going on, come up with a solution, or I could haul off and punch the wall next to me, right? So both of them came from the anger emotion, but I handled one appropriately, one not appropriately. The other thing that I always tell people is, again, sort of to try to lighten the mood when it's a first session after they've just been diagnosed, too, when they come to me and say things like, I feel like I'm going crazy, or that I've never experienced depression or anxiety before, is that some emotions make sense, right? If you came to me and you had just gotten diagnosed with cancer, and you told me that everything was sunshine and rainbows, right? I think I'd be more surprised than experiencing sadness and anger and fear. Common experience as well. I also get asked this a lot. What are common mental and emotional experiences that happen during the cancer journey? Again, hearing these responses from people that come in and tell me that they feel crazy, and having to reassure them that they're not. My disclaimer with this next section that I always give is that if your experience is not on this following list, it does not mean that your experience is not normal. Right. This list comes from stories I hear the most often from people that I have worked with. It's sort of, again, a summary of stories I've heard over the course of my time as an oncology clinical counselor. If yours is not on the list, I'm sure I have talked to someone with a similar experience. Because while there are commonalities amongst individuals that are facing a cancer diagnosis, each person's cancer journey is unique to them and is still valid. So, some common experiences: fear of recurrence, relapse, or secondary cancer based off of what type of cancer you have. Survivor's guilt as well. That's a big one. Witnessing others facing active disease or even end of life and feeling personally guilty for doing well or even just still being around. What I always tell people is that you surviving and thriving does not mean others are negatively impacted. Your journey is unique to you and theirs to them. People with active disease or at the end of life would not blame you for living yours to the fullest. And I've talked to people at end of life that have said that. Um, your experience is as valid as the next person, regardless of your cancer type, stage, treatment, or side effects. What I always, again, tell people that I work with is that cancer is not a competition, so let's not make it one, right? Um, so the other aspect is, again, comparing to other cancer types or minimizing your own experiences because someone thinks that other people have it worse than them, or again, sort of making it that competition. Not feeling like a survivor. We use the word survivor in cancer research and marketing and treatment. And some people don't feel like that word fits for them, and that's okay. You can choose a different word, whatever word fits for you. Um, you know, you may also feel like you're in this limbo zone when it comes to the word survivor, especially if you've reached survivorship. Not quite like a survivor yet, not quite like a patient. Your medical team may have had that moment of, saying, "Yay, we're happy, you're cured, go on with your life." But you are sort of somewhere in between still. Your treatment has gone well. Maybe you're in remission, but you feel other emotions as well, and that's normal. Research shows us that for many, psychological symptoms set in after treatment is over for those that are curative. Research also shows us that around 50% of individuals with a cancer diagnosis will endorse experiencing a significant distress during their cancer journey. Um, Other ways in which people feel in limbo as well is anxiety, as they sometimes call it, that anxiety before a scan, waiting results, wondering if the treatment is working while you're, um, receiving the treatment between scans. So there's a lot of, again, unknowns, right? As the title suggests. Difficulty with treatments and side effect management. Uh, all treatments come with their side effects, right? If we take hormone treatments, for example, that can, once someone's in that survivorship stage, but is in for certain cancer types and is getting hormone treatments, those comes with mood changes, joint pain, sexual intimacy concerns, um, and some people may not understand the impacts it has. Again, that mindset of you're cured, everything's fine. Well, they don't always understand. And so I believe what I always tell the people that I work with is that uh, it's okay to politely educate others on your diagnosis if you feel comfortable doing so. And it's okay to tell them that certain comments are hurtful uh, if they've hurt your feelings. A lot of times people don't know, right? And if we just educate them politely, they won't do it again, or they would have never done it in the first place. I always tell people that the world is full of well-meaning people that just miss the mark sometimes. Uh, and again, many other treatments come with side effects too. The top side effects I hear from people are fatigue, nausea, diarrhea, constipation, vomiting, even neuropathy. It's difficult to manage side effects sometimes, and hopefully your team is working with you to figure out managing those. There's also difficulty with managing chronic illness. A lot more cancers are becoming more chronic illnesses, right? Living long terms with a diagnosis that may not be curative, but can live a long time with treatment. Uh, some people, again, might not understand the difference between a chronic illness versus an acute illness and the different and sometimes long lasting impacts a chronic illness can have. Again, okay to politely educate, tell them how those comments make you feel so that they know and have a better understanding of what you're going through. Um, the next one I always just refer to is the you don't look sick bias, right? People have this tendency to think of what somebody with a cancer diagnosis is supposed to look like based off of movies and TV shows. Well, that's not how that works. Some people might think if you look fine, then you must feel fine, and that's oftentimes not the case. So again, educating people. There's also many people might question their belief system, religious or not. I've seen that a lot, sort of wondering, asking those questions of why. And then the final one that I like to end on here is that perspective change. Cancer can drive you into fear and isolation, or it can motivate you to find what is important in your life. I often see people that are uneasy saying, uh, that something positive may have came from their cancer journey. But eventually, people oftentimes see how their diagnosis led them to focus more on what is important in their life and what's meaningful to them, and that's very powerful. So, tips and strategies. What can you do to cope? First, my number one recommendation, and I get it, I'm probably biased as the counselor, right? Is talk to someone, whether it's a trusted family member, a friend, fellow survivors, or a mental health professional like myself. And ask for help, whether it's physical or emotional help. We are social beings, and it's okay to ask for help. I can't tell you how many times I hear someone call themselves a burden to their family. And the fact of the matter is, you are not a burden. Um, they say that they don't want to be a burden with their struggles or experiences, don't want to talk about it. Not once have I worked with a caregiver that said their loved one was a burden. I truly have not. Sure, things can get stressful. Sometimes people can get frustrated, but it's always at the situation life has given you and your family and your friends, not you personally, right? It's we're angry at cancer, not you. Um, Also, people are more often receptive to being supportive than you may think they are. I oftentimes encourage people that I work with to think about, hey, can you think about a time that you helped somebody else? And how did you feel afterwards? And people say, well, I felt good. It made me happy to see them happy. Well, those people in your life are also going to feel that way about helping you. So don't be afraid to reach out for that support. There's also things like mindfulness exercises, such as meditation or deep breathing, grounding exercises like the 5 4 3 2 1 technique or guided imagery. We'll go over some of those as well here in a second. And then journaling as well. Journaling is usually one of the first coping skills that I recommend to those that I work with. Journaling your, emotions, thoughts, experiences, gratitudes, symptoms, and side effects, even. And the reason I recommend it so highly is that there's a research study that shows us that individuals with a cancer diagnosis who journal those things that we listed there have better quality of life outcomes than those who do not. And that's because they have improved communication with their care team and their caregivers. So their medical care team, like us here at Illinois Cancer Care, as well as their loved ones around them. And so ultimately get more timely and more efficient care. Some mindfulness exercises we'll go over first. And again, if you want the slides, and it sounds like they'll be posted, all of these here are that are underlined are links to different videos, ones that I send people personally when I'm working with them. Uh, and they're good guided ones on YouTube for free. Um, so deep breathing exercises help re-regulate our central nervous system. That helps provide a sense of calm. Mindfulness exercises can help us be more in tune with our body as well, so we can notice changes. Uh, Disconnects ourselves from those, or can help disconnect ourselves from those stressful thoughts and emotions. Sort of being able to take a step back and say, "My brain produced this thought or this emotion. What do I do with it now?" Helps train our brain to focus on the here and now, which can help with things like anxiety. It can also help release tension in the body. Things like progressive muscle relaxations really help with that. There's many out there. If you know, look on YouTube for these different kind of things, they will be plenty out there. But these are the ones that are my favorite. Uh, they're listed. So I thought this morning, as we're all still waking up and things, we could do one together to sort of start our morning. So I'll go ahead and we'll do a mindfulness breathing exercise together here. So I invite you to sit with your feet flat on the floor and your back straight, either fix on a spot or close your eyes. And bring your attention to your breath and observe it as if you're a curious child who has never encountered breathing before. Notice the air as it comes in through your nostrils and goes down to the bottom of your lungs. And notice as it flows back out again. Notice the air moving in and out of your nostrils, how it's slightly warmer as it comes out and slightly cooler as it goes in. Notice the subtle rise and fall of your shoulders, and the gentle rise and fall of your rib cage, and the rise and fall of your abdomen. Fix your attention on one of these areas, whichever you prefer, on the breath moving in and out of the nostrils, on the rising and falling of the rib cage, or the shoulders, or the abdomen. Keep your attention on the spot, noticing the movement in and out as the breath comes and goes. Whatever feelings, urges, or sensations arise, whether pleasant or unpleasant, gently acknowledge them, as if nodding your head at people passing by you on the street. Gently acknowledge their presence and let them come and stay and go in their own good time. And keep your attention on the breath, observing it with curiosity. Whatever thoughts, images, or memories arise, whether comfortable or uncomfortable, simply acknowledge them and allow them to be. Let them come and go as they please, and keep your attention on the breath. From time to time, your attention will wander as you get caught up in your thoughts, and this is normal. Each time this happens, notice what distracted you, and then bring your attention back to the breath. No matter how often you drift off, whether 100 times or 1,000, your aim is simply to note what distracted you and refocus on your breath. Again and again and again, you will drift off into your thoughts. This is normal and natural and happens to everyone. Our minds naturally distract us from what we are doing. So each time you realize your attention has wandered, just simply acknowledge it. Notice what distracted you and return your attention to the breath. No matter how often your attention wanders, gently acknowledge it, note what distracted you, and then refocus on your breath. And when you're ready, bring yourself back to the room. and open your eyes. So what I like about that exercise, as well as the ones here that I've linked, is that it rolls with your thoughts, right? Unless you have been practicing mindfulness for many, many decades, we can't just clear our mind, right? We have to roll with those thoughts. And many meditations out there, uh, sort of focus on trying to clear your mind, and that's just not possible. I see people get frustrated, and then they stop trying these things at all. Um, Hopefully, people felt relaxed after that. I'm sure you might notice that your mind wandered. I always tell people during this, and it's true that my mind wanders during it too. I'm thinking about what am I supposed to say next, or what's next on my slides, that kind of thing, and I have to bring myself back, right? And so it's normal, and it's about rolling with that. And this helps us to train our brain to have those thoughts without judgment. I always tell people too that mindfulness exercises is a lot like going to the gym. You got to start small and grow that muscle. It might be that you become frustrated at first, or you find your mind watering a lot more. As you build that muscle over time, that's going to become easier, and you're going to see a difference in your day-to-day life. Square breathing. So I like this one because this is then one that you can use anywhere, right? You're out and about, you need a moment, this can be used. So you can visualize the square even to help engage those senses more. Again, can be used anywhere. And also we can decrease the time here if needed. So, as we're going across the top of the box, we're inhaling for 4 seconds. As we go down the right-hand side of the box, we're holding that breath in for 4 seconds. And as we go across the bottom of the box, we're exhaling evenly over the course of 4 seconds. And as we go across the left-hand side there, we're holding the breath out for 4 seconds. Again, decrease that time if need be for yourself. If 4 seconds is too difficult, that's okay. And again, with deep breathing, we should always be trying to breathe from the abdomen. You should feel your stomach rise as you take a breath. That makes sure you're taking a deep breath as opposed to if you're taking it from your chest or taking more shallow breaths. Grounding exercises. So the top grounding exercise that I always recommend to people is called the 5-4-3-2-1 technique, which we can see here. Helps us focus on the here and now. So our brain's really only good at processing one thing at a time. It switches back and forth rapidly, but it's really one thing at a time. So if we can focus on the here and now through the environment and telling our brain to focus on different things and engage all these senses, it helps shift the focus away from what's bringing us anxiety. So the 5-4-3-2-1 technique is, five things that you can see around you, four things that you can touch, three things that you can hear, two things that you can smell, and one thing that you can taste. Um, and again, those are sort of in descending order of how difficult usually they are for people. And even, when using these senses, be descriptive, right? Maybe, again, I see this, my desk that I'm at, and it's gray and it's smooth and it's got sort of a heathered texture to it, or I can feel it and say it's smooth, but maybe a little cold, or again, engaging all those senses and being descriptive can help bring the brain back to the here and now. Next steps. So, how do you find help if you're facing a cancer journey? Um, so, my number one thing that I tell people is to reach out to your oncology team. The sort of, again, humorous way that I go about this is, again, I wouldn't have a job if you were alone in this, and so we know that cancer comes with a mental toll, and your oncology medical team knows that too. So reach out to them. A lot of times, cancer treatment centers have their own support staff available that can either provide direct help or they can guide you in the right direction. For instance, so here at Illinois CancerCare, I provide short-term diagnosis-focused individual counseling, and so that just means diagnosis-focused means focus on the mental and emotional impacts of a cancer diagnosis. I also run two support groups, one on Wednesdays that has regular guest speakers that at 1 o'clock, and that's for all cancer types. And we've got one on Mondays at 3:30 that I run for gynecological oncology. And I also help people find other counseling resources in the community. And here at Illinois Cancer Care, we provide these services free of charge to the patient. Um, Other things that are beneficial, um, Psychology Today, they have a great search engine for finding therapists near you. You can filter down by uh, insurance, in person or virtual, topic, and many different other things as well. There's also the Calm YouTube page. So many of you have probably heard of the Calm app. I'm all about the free personally. So their YouTube page has a bunch of great resources that can be used. A lot of different mindfulness videos that I think are great. There's also Therapy in a Nutshell is another great YouTube page, again, free, that has a bunch of mindfulness videos, sort of perspective videos on mental health that I think are good. And then there's also the Insight Timer app. So that's a free app that sort of has sourced uh, mindfulness videos and deep breathing exercises that are free of charge from creators. And then also talking to your PCP or your oncologist. Again, they know that this is taking an emotional toll too, likely for many people. They're not afraid to talk about it. They can help out and provide referrals as well. Other popular apps that sometimes I recommend, the Calm app or the Headspace app. They have paid versions of it. So again, I usually try to direct people towards the free stuff, but they're good as well. Even our smartwatches, right? Every hour, my smartwatch is telling me to do a 1 minute deep breathing exercise. Even getting more into the routine of that can be helpful. So I wanted to thank the entire Craig team for inviting me to, share my work with this community. And if there's any questions, I'd be happy to answer.